Hi, everyone. This is my understanding of client assessments. This is a process of understanding our client's current needs as a whole person. A psychological assessment is the process of gathering information about the client's thoughts, emotions, behaviors, and functioning in order to better understand their concerns and how we might guide them throughout their treatment. So, a psychological assessment can be taken in a couple of different forms. It's a formal assessment or an informal assessment. The formal assessments include standardized tools like a PHQ-9, which measures the client's severity and depression, or a HSCL, which looks at symptoms for anxiety and emotional distress. Other examples include structured interviews like the SCID-5, which is a personality assessment like the MMPI, um, or anxiety inventories like the STAI, the STAI. This is per Deborah Schwartzman from our MEDEPSI YouTube video that the professor listed, the MEDEPSI Psychological Services from 2018, that we listed on this assignment. So that's the reference for these assessments. An informal assessment happens through things like clinical interviews, observations, even noticing patterns in how your client's speaking, expressing themselves, their body language, that all tells a story. So, for example, clinician might notice a client's avoiding eye contact, that they're speaking in absolute terms like always or never. Um, we might notice closed off body language when the client's sharing about a particular person or situation. These little personal cues let us know the informal assessment. So these observations are assessment processes just as much as our formal tools can be. So really, the assessment is both structured and fluid because it combines measurable data and human understanding. But according to this week's YouTube video with Professor Pash, who I enjoyed watching, on the psychological assessments, this was from June 2018. When we're assessing a client, there are several important steps that a clinician should follow. The first thing is an informed consent, which we covered earlier in our studies. The client needs to understand exactly what the assessment is, why it's being used, and how the results will be handled. The second part of our assessment would be gathering background information, including presenting concerns, history, current processing, um, and their actions. This is often done through the intake interview. Then the third thing would be selecting an appropriate assessment or appropriate assessments. Um, these should be valid and reliable and appropriate for the client's age, their culture, and their presenting issues. The fourth thing is administering each assessment accurately. This includes our complete understanding of how to collect the data for each assessment. Um, the fifth is interpreting the results carefully, taking into account the client's uh, context, not just the score. And then finally, providing feedback to the client in a way that's clear and supportive and helpful. The goal is not just to label them, it's also to empower them for their understanding. An assessment's not just for collecting data, it should be an ongoing, evolving thing that we do from time to time as the client goes through therapy. Um, Regarding ethical issues that can arise during psychological assessments, one major issue, especially for beginning counselors like all of us will be, is competence. And that's what we covered in our ACA Code of Ethics. the 2014 uh, American Counseling Association Code of Ethics. And this is in section C2A. It covers counselors must be properly trained to use and interpret assessments. For example, using complex personality tests without adequate training could lead to misdiagnosis, and some of those have to be done with specialists like doctors who are trained in that, like psychiatrists. Um, Another issue is informed consent and an explanation of the results. Clients have the right to understand what's being assessed and what each result means. So, given results without an explanation can just be confusing and ultimately cause harm. Cultural bias is another one of those things to consider. Some assessments may not be um, valid across different cultural, socioeconomical groups. Um, Socioeconomic groups. Sorry, I said that wrong. Which could lead to inaccurate conclusions. There's also an issue with confidentiality. Assessment should be handled with sensitivity. It must be protected carefully, especially in a world of digital and telehealth sessions, as we just covered. Um, our best ethical assessments require not just knowledge, but our intentional care of how we select and administer the assessment, but also how we communicate the results. So, the takeaway here is that psychological assessments should be ongoing, they're multifaceted process. Um, that's going to help the counselor develop effective treatment plans. But when we do this thoughtfully and ethically, it can provide valuable insight and support uh, meaningful change for our clients. So thank you all for tolerating this video, and I look forward to your comments. My references are number one being the American Counseling Association's 2014 Code of Ethics. The second one would be the video that was posted from MedEpsy Psychological Services, the YouTube channel with Dr. Schwartzman, what happens during a psychological assessment from 2018. And then the third one would be Professor Pash YouTube video from 2018 on assessments, professional assessments. Anyway, thank you.